This is case of the week number 12. My name is Dr. Johnson and I'm a gynaecologist from Southampton. The patient's 25 and presented with heavy painless bleeding 7 weeks after delivering her baby. The baby was born normally with an intact placenta. She was breastfeeding and had not yet had a cervical smear. She was too young for that. Here are 2 images taken at the time. This is the anterior wall of the uterus, fundus, posterior wall, cervix. And this image has got colour Doppler information. Again, anterior uterus, fundus, posterior, back up to cervix. Here are some video images taken at the time. The video on the left is without Doppler, and the video on the right shows Doppler information. In this image on the right, I'm moving the probe longitudinally from one cornu to another. What's the diagnosis? Is it a cervical condyloma, cervical cancer, cervical fibroid, cervical sarcoma, or a cervical placental polyp? If we look at the images again, this is a longitudinal view of an anteverted uterus. It's almost axial. And here you can see a mass in the region of the cervix, but it is surrounded by very thin epithelium. And then in this image you can see a large feeder vessel going to this mass, which is not very vascular. You can see it all better on the video images. Here is the mass. You can see how it moves within the cervical canal. You can just see the cervical canal around the mass if you look carefully. Just there. You can see just there. So this mass is not part of the cervix, it's in the cervical canal. And if you look at the colour Doppler information, in this image I'm moving the probe laterally from side to side. You can see the mass itself is not that vascular, but it has a very strong feeder vessel to it, which originates in the posterior uterine wall. You can see again as I come back that way, posterior uterine wall, feeder vessel up to the mass. This was a cervical placental polyp. The mass was in the cervical canal, not in the cervical stroma, unlike cervical cancer where it is in the cervical stroma. There was a good sliding sign. The structure moves freely against the walls of the cervical canal, again unlike cervical cancer which is fixed in the cervix. The mass itself was not that vascular. Again, unlike cervical cancer, a lot of that would be very vascular. And you could see where the feeder vessel originated. It wasn't coming from the cervical stroma, it was coming from high in the endometrial cavity. And given the history of this lady had just delivered, it was most likely to be a placental remnant, even though the placenta was thought to be normal at the time of delivery. The diagnosis of cervical placental polyp was confirmed at hysteroscopy when it was resected. Thank you.